Welcome to another edition of On the Level. I'm Brian Malloy, the President and CEO of Levvel, and today I'm really excited to be speaking with Dr. Anmol Kapoor, who is the co-founder and CEO of Cardia AI, a leading edge innovator in AI technology, and one of Levvel's new partners. Before I turn it over to Dr. Kapoor, I'd like to tell the audience a little bit more about who you are, because from what I know of you in the last several months of getting together, I know you're not going to say a word, so allow me to do this. So you're a cardiologist and a clinician by training, but you're an entrepreneur, a humanitarian, a philanthropist, and even a Bollywood film producer, which was an interesting one. But it's all in the spirit of that humanitarian thing that really, I think, is who you are. So you've received all these awards, and I have to read them out, and I'll stop about 10th way through. But you've received the Hind Ratan Award, the Jewel of India, received that in New Delhi, the Pravasi Ratan Award, and the Mahatma Gandhi Award at Capitol Hill in Washington, and the House of Lords in London. I know you're a public speaker. You've spoken internationally in the field of improving healthcare and outcomes in vulnerable minorities, refugees, women, and children. And I saw online something with you actually speaking with Barack Obama, amongst others, which would have been an incredible opportunity as well. I mean, I could keep on going, Dr. Kapoor, but we only have 15 minutes, so I really wanted to have our listeners listen about the exciting stuff that your company and your team have done with respect to COVID testing and stuff, because my understanding is it's going to be the new gold standard of testing going forward. And unlike some of the others that I hear, this is a rapid test. And I think one of your team members was talking to me and said, Brian, we could actually test a 737 in less than an hour. And so when you talk rapid testing that's out there now, and it's 2 days, that's not really rapid to me. Less than an hour, that's rapid, and that is so cool and so what the world needs. So I wanted to turn it over to you and tell us a little bit about Cardia AI and this test that you've got.
Thank you so much, Brian, for introduction. Well, like Mahatma Gandhi has said once, be the change what you want to see the change in the world. So that's a model I try to follow and try to bring the best in humanity, how we can help out each other. And there's a gap that exists between rich and poor. There's a gap that exists between various countries. Among in those countries, various socioeconomic status itself differentiates who will end up living longer and who will end up living shorter. It's just because who their connections were, what access in healthcare they're able to get it. So when Cardia was founded, at that time, our principle, and still is, to level this field between rich and poor. The access to medical diagnostics should not be only accessible for rich in this world. It should be every human being on this earth should have that access, same blood test or same imaging test any rich person can get access to. And with that motto, we founded our company, and with the same motto, we were able to develop various technologies in Cardia AI to help either speed up the diagnosis with the cardiac monitoring or improve accuracy of nuclear imaging in cardiology, or if we are trying to disrupt the laboratory business, which has been stagnant for the last 50 or more years, get them out of this traditional laboratory model which exists right now. And the model is that a doctor would order a blood test and you would go to a laboratory and get the bunch of blood tests done, and then you wait for the result, and doctor would call you that you know what the result is. You may be in a pain, you may be dying, you may be having a very critical situation, but the process is still the same. Either someone is coming to your office or to your clinic or to your bed, getting the blood test done, but they're going back to the same brick and mortar laboratories and spinning that blood. And our aim is to disrupt that part of the business on this earth. And this is how Cardia came to existence, where we end up developing various pathways. The way people are able to check up their blood sugar, they should be able to check up their kidney function, heart function, their hormones, their liver function, etc. So with the same accuracy as they will do the blood test in any laboratories. So we stumble upon that our technology and other pathways which we have developed, they can also help us with the COVID test. So it would have been wrong and inhumane if you know the path, if we know somehow we can improve this rapid testing, which is quite accurate. And help so many people and so many companies and so many countries. We didn't want to keep it secret, so we proceed ahead with applying for FDA approval and getting this test out to the market. So what this test is, the process is not new. The LAMP assay or this test is based on isothermal amplification of COVID virus or any other viruses of RNA or DNA. We can amplify that. And this process was first discovered about 20 years ago. What we have done is we have improved the gold standard. And that's what I believe in Cardia AI. Just pick the gold standard. What other people believe right now today is make it better, set up the new gold standard. So this way, then you are leaving a mark on this earth. Exactly the same model we applied on COVID test using this LAMP method, which allows us to rapidly analyze RNA very accurately with 100% specificity. When we say 100% specificity, mean is that there is no other virus or bacteria we are picking up. When we are picking up, we are telling you or someone who's getting the COVID test and comes back positive, it truly is COVID, there's nothing else there. So when we say 100% specificity.
So you take a sample of somebody, like a throat swab or a saliva swab from somebody, and then you put it in this lamp. I guess I'm really simplifying it here. And then you just kind of turn up the heat a little bit, and then you replicate that RNA to get a piece of it big enough to be able to recognize?
Well, let me simplify that a little bit further.
Very good.
Okay, so we have to understand the bottleneck, where does bottleneck exist, why we were struggling to get antigen antibody-based tests out to the market, because the laboratories are stuck to the same traditional pathway. There's no new innovation happen since we have developed the technologies. So for example, we take a swab or we take a saliva of a sample and we do have to separate that virus RNA by using various traditional methods. That RNA separation takes anywhere from 30 minutes to 2 hours depending on the machine, and there's a labor intensive work person has to do as they have to spin it and trying to bring it out, this RNA sample. And then you take this RNA, this sample, after spinning it and processing it, you will add some chemicals called reagents, and those chemicals, you'll mix it and put it in the PCR. The qPCR or RT-PCR machines, what they do is they do internal heating of the sample. And depending on the brand, it takes about 2 to 6 hours for that slow cooker to cook that sample. And you can put in 96 tests in it. You can put, depending on the brand, you can maybe put a little bit more, but you'll have to wait for those 2 to 6 hours, and you can't do anything. So first you have to spend time RNA separation, then you add these chemicals and put in a PCR machine. Now you're waiting on average 4 to 6 hours, then you get the result back and you have to let the person know there's a bottleneck. And we want to expedite this bottleneck, this gold standard, and set up a new gold standard. This is how the LAMP came to existence. How LAMP works it? So you are still taking the swab, you're still doing the saliva, you will do your RNA separation. And Cardia is developing a proprietary RNA separation method, which will not require a spinning. And in the meantime, you would do the spinning and you get the processes done much faster than the traditional way. And you would add a CoviLamp. CoviLamp is a chemical which you add on to this sample, which we have taken from your swab, from your saliva, from your nasal segment. And when you add a CoviLamp, then you're going to put it in 3 different ways. If you have a PCR machine, which was taking 4 to 6 hours for you to cook the result, if you want to use our chemicals, the result will be back to you in 15 minutes. So you don't have to wait for 4 to 6 hours. So that bottleneck, suddenly lightning speed expedited for you. So your lab can increase capacity, and think of this way, you have the same engine, same car, now you can carry more passengers. So now you can have more people and more results out from the same machine. So you're increasing the horsepower by 10 times suddenly.
So you could take this whole process and put it right at the facility that you're talking about, say an airport or a school or something like that, and do the testing right on site?
Yeah, literally. So you don't have to wait for 4 to 6 hours for the lab to process that slow cooker or PCR machine to process the result. You can get a result in 15 minutes. And then you can put, depending on the model, you can get 96 tests done or 400 tests done in that 15 minutes.
That's so. What is everybody waiting for? You've got this test. You've got everything right here, right in Calgary. You've got like this great team of scientists and physicians and engineers behind you. Is it just FDA approval that we're waiting for, or?
Yes, so we are waiting for FDA approval, and we know this concept, this method that works in our bench research. We have submitted all this data to FDA. So we are expecting a positive outcome from there's a laboratory right now in US, California, and they are using our test. And the data we are getting, preliminary data from them, is quite positive as we expected it. They will be sharing this data with the FDA next week sometime, and then we expect FDA approval afterwards. And after that, we'll be able to then sell this chemical and this method to various laboratories in the United States. But something important to note that labs don't have to wait for FDA approval. They can still start using our chemical, our method to expedite their results. It's called LDT, Laboratory Developed Test. Same way, Health Canada, when you look at from Alberta, let's talk about Calgary. So all the COVID testing is done in Alberta Provincial Lab. And Alberta Provincial Lab, what the chemicals they're adding on and the way they're using in a PCR machine, the slow cookers. So what happened is all this whole method is not Health Canada approved. It is called LDT, it's a lab developed test. It was developed by Winnipeg National Laboratories in March, and they end up teaching this method to Alberta Provincial Lab, and they start following it and identifying COVID samples from known COVIDs. So all these laboratory developed tests are not Health Canada mandated. Health Canada only approves us once we submit the data from United States laboratories in next few weeks. Health Canada will take its own time as things will happen, but that doesn't stop Alberta Provincial Lab or DynaCare Lab or Life Lab or any other laboratory in Calgary or in Canada to not use our test. What they have to do is they look at the data and they say, Dr. Kapoor, we like this data, we believe in this test, and they can start using it without waiting for Health Canada approval.
Yeah, you know, Dr. Kapoor, this stuff can't come fast enough. And it's so, to me, it's so exciting that it's right here in our backyard, especially as I have a daughter who is a physician or a resident physician right now. So I share with her a lot of the stuff that you and I talk about this. And it's just, to me, it's incredible that all the stuff that, you know, Cardia AI does. And the last question we like to ask our guests, and this has to do with our brand, is I look at all the things that you've done, all the things that you're doing, and we also talk about this somewhat. How do you bring business in balance? I don't know how you do it in 24 hours, all the stuff that you do. So how do you bring business in balance?
I'm still learning. I don't know. If you ask my wife, she'll tell me that I'm not doing the balance, and I may be workaholic. I do find disturbing that why they limited 24 hours in a day. Like, why they couldn't make a 48-hour day?
Yeah.
So that's something I'll grudge. I'll complain about it. I'm looking for more hours to be made. Until that time, I'm trying to push as much as I can. And in my own heart, like people ask me like how I'm not able, I don't feel exhausted, like how I'm able to push it. I enjoy that. If you enjoy something, if that's your passion, that's your hobby,
Absolutely.
and your hobby to help someone, if you stumble upon a way to help someone, I want to do that. I don't want to wait for it.
So, you know, what is the best way to learn for anybody that's listening to this? What's the best way for them to reach you?
I'm available on social media. If someone would like to reach out to me on Twitter, twitter.com/AnmolMD, ANMOLMD. I'm also available on Facebook, available on Instagram. They can reach out to me there, leave a message. And if they want to email me, they can contact me through cardiai.com website, and the email will get to me from administrators.
cardiai.com. Okay.
Yes, please.
I can't tell you how much I appreciate with all the time that you don't have just to spend the time with us today on the level. So thanks from the bottom of my heart.
Thank you so much. And it is a privilege and honor to work with Levvel. And it's an amazing team. And we are humbled and honored to have you as our partners. And with your help, we will level the playing field between
like
rich and poor people.
Yeah, that's awesome. Thanks very much.